Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer of Douglas County, and today it's September the 16th, and we're doing another of our updates today. I'm joined today by Dr. Stanackzai, who is one of the resident physicians at Aviva, and Dr. Heidi Beery, who is another physician at Aviva, and she's also the head of our very successful residency program here in Douglas County. So going over where we are with COVID now, we're at a bit of a lull, and that is a good thing. So in the world, almost all of the continents are seeing a decreasing number of COVID cases, although the number of deaths remains somewhat high. We're still seeing a fair amount of disease in Asia, in the Middle East, and Africa. And those are very worrisome areas because we know with the dense populations in those areas, the disease can spread quickly and new variants can develop. But overall, the world is a bit quiet at this time, and that is certainly great after summer, which was just so bad. In the US, we're about flat in the number of cases, although we're still seeing a very high death count. So we're seeing well over 1,500 deaths per day, which is really quite tragic. You know, in this last week, we remembered what happened on 9/11, which is a terrible, terrible time, and resulted in 3,000 deaths. But every 2 or 3 days, we're having another 3,000 deaths from COVID, many of which I think could be preventable. In the US, this outbreak started mostly in Missouri, spread down to Arkansas, and then down to Louisiana, then spread east through Florida, and now is spreading up in the upper southeast area. So Kentucky, Tennessee, West Virginia are really struggling. We're starting to see an increasing number of cases in Ohio and Indiana, and so there's a big concern there. We're seeing a lot of overload in those hospitals in the southeast, mainly because although they're past their peak of cases, many of the people in the hospital stay for a long time. And this is something we'll talk about with our guest today. Otherwise, in the United States, we're seeing still a high number of cases in Wyoming, in the upper panhandle of Idaho, and then in places in Oregon. In Douglas County, we're still having a stubbornly high number of cases, clearly down from where we were 2 weeks ago, but we're still seeing 60 to 100 cases a day, which is really a very high number. Unfortunately, many of those cases result in hospitalizations. And although our hospitalization numbers are now down to the low 80s, it's still a really, really high number, which really stresses out our whole healthcare system, most especially the hospital. And sadly, what we've seen in the last couple of weeks is many of those people who were diagnosed in the mid part of August, hospitalized for a while, are now losing their battle, and we're seeing more and more deaths. And so since the beginning of August, we've had over 90 deaths. Remember, all in the first months of this, between the very beginning of this pandemic in January of 2020 through the end of July, we only had 90 deaths. So we've had more deaths now in the last 6 weeks than we did in the first 18 months. So we're still in the midst of this. What we are seeing is the vaccines are still really quite effective. Your risk of being hospitalized is 10 or 20 times greater if you're not vaccinated than if you are vaccinated. We still have plenty of vaccines around. They seem to be safe and effective and very widely available. So let me talk today with our guest. So as a pediatrician, I have dealt with a bunch of COVID in the outpatient setting, but thank goodness I've not dealt with any kids who've been hospitalized. But unfortunately, these two doctors have spent a fair amount of time dealing with people in the hospital who have been sick with COVID and really have quite the stories for us to tell. So Dr. Stanackzai, please tell us about your experience in the hospital.
Sure. So I started out in the beginning of August on my inpatient medicine rotation, and I didn't know what to expect. Of course, I've heard of COVID and the cases over 600,000 deaths, but my first day I had 2 or 3 COVID patients, and I was just overwhelmed. There's so much that we have to do. And so, I hit the road running, just trying to learn as much as possible, trying to manage them. And most of those patients ended up in the ICU, and soon after they died. And this was within my first week. I had not seen so many deaths, or if it was my patient or my co-resident's patient or the patient next room to my patient, it was just horrible to me. And I had never experienced such a thing where so many people were dying. in medical school, it was usually a very ill patient, complicated, elderly. But for most of these patients, they seem like if they were in the hospital for anything else, they would survive. But seeing them starting off on oxygen, then to BiPAP, and then intubated, almost every patient week after week, I can say it was traumatic. And we've had some tough times at the end of the day where you're like, am I even doing anything? It just tells you how horrible this disease is. And oftentimes I would be the last person speaking to that patient before they were intubated, and then they never came back to talk to anybody else, their family members, their parents, their sisters, brothers. I or a nurse would be the last person they requested something of. And oftentimes they would be here for a long time, 2 weeks before they passed away, and that time I would get to know them. If they had a dog at home, or if they had grandchildren or children that might visit, and they would ask, and I would say, I'll see what I can do. And it was just so difficult for them to stay awake to even try to get a phone call, and they would literally die alone with one of us just being there at that time. And in the beginning, even I was a bit naive, but thinking, okay, this patient's going to get better. They're looking good today. Their oxygen demands aren't as bad, but the next day they would just go down. So after a while, it was difficult for me to even look my patients in the eye and tell them that it's going to be okay, because I realized how horrible of a disease this is. And one day it could be fine, the next day it could be intubated. So it's just, I felt powerless a lot of the time.
Well, that really is heartbreaking. And the separation of people when they're sick in some of their most difficult times from family has been one of the most heartbreaking parts of this whole pandemic. So you're a relatively new physician, don't have the long arc of history. Heidi, you've had a lot of experience. Tell us how this compares with your experience in the past.
In the past, well, like I said, the death was a rare thing in the hospital. Even with most patients that I managed during medical school, they would get better. After a week or two, we would send them off home. We would have one patient that may have stayed a long time, like a month, and that's multiple complications that would pass away. But here it's every day, one or two of my patients or my co-residents were just passing away from COVID, and not from their multiple other complications that they might have, diabetes, hypertension. Those were always manageable, and I would see patients leave before. But now when they come in, they stay, they get intubated, and unfortunately they pass here. And it's just, if they had a vaccine or something, they could have survived. And some of the patients were elderly, but a lot of their most recent ones, they were in their 40s and their 50s. So that young, and having young kids and elementary school and wife at home, and for them to pass away, I've never really seen that before.
Wow. And so, Dr. Beery, how does this compare with your experience?
Interestingly, I was in the same position Dr. Stanackzai is in when the H1N1 pandemic went through. And it had some similarities because people would come in sick, but I remember losing one patient then, and it was such a huge impact at the time when we lost one patient. I thought, oh, this is so dreadful to lose one patient to this flu epidemic, and I thought that was the worst I was ever going to experience back then. And I remember having so many sick people in the ICU intubated, but most of them got better, and we just lost that one patient back then. And this is such a different experience to have the whole ICU filled with all of these patients sick with COVID, and know that most of them aren't actually ever going to get extubated like previous. I've never seen this time when we have these young people so sick and not have this confidence that the medicine is going to work, that we're going to be able to get them better. And so it's very devastating to feel so powerless. Really our only thing is prevention and doing the vaccine. And once they're coming into the hospital, they're sick, we try our best, but there's just not as much that we can do this time.
So we hear a lot of rumors, and we've tried to adjust these rumors in our previous Facebooks and whatever, but we have two people who've been right on the front lines. So one of the rumors is, well, these people don't really have COVID. They really have other things, and we're just calling it COVID. Tell us what you think about that.
I actually had that conversation with a patient today. I had a patient who told me that there's lies out there that the hospitals are really empty, that there's no such thing as COVID. And I said, look, I've been your doctor for a long time. Don't you know and trust me? The rooms are not empty. This is absolutely a real virus that people are dying from. We know that this exists, and this is not something that is made up. And I don't know how else to explain the science to you, other than, you know, if you can't trust in our relationship that much, I don't understand what else to say.
Wow, that is worrisome. The other thing we hear is that, well, there are a lot of people in the hospital who have complications of the vaccine. Have either of you treated anyone in the hospital who was there for a complication of the vaccine?
I personally didn't see anyone with complications. In the few things that patients that I've seen that have received, and like office visits, they complained of some sore arm and some aches, but that went away after a day. And these are patients that were really against the vaccine in the beginning, but they've kind of seen what a toll it has taken on the community, and they've personally known someone that passed away from it. And now that they're open to taking the vaccine and have taken it, the most they complain about is some sore arm, but nothing in the hospital that from anything.
Yeah, the worst I've had is a patient needing to go to the emergency room for some IV fluids after a high fever, but nothing that has needed hospitalization. I agree. Yeah.
One of the other rumors we hear is that this is just like the flu. It's no different from just the regular seasonal flu. And certainly in my experience, it's much worse. Dr. Beery, it sounds like you have the perfect vantage point, having worked at the hospital during both our worst flu pandemic in the last 30 years and this. How do they compare?
Oh, there's a lot of things that are different. We do know that it's now more, at least with this variant, the Delta variant, it's more infectious, so it spreads to people more easy. It's interesting in just how how you feel and experience it. During COVID, I have found that people cough more and it's more painful, and so it's just miserable to get. And then you're more likely to get really sick from it and die from it, and so it's not something you want to get. And then now we know that we have this post-COVID syndrome, and so up to 1/3 of people can end up with post-COVID. And so I've had multiple patients now who have this post-COVID syndrome, and the symptoms, the three primary symptoms are fatigue, shortness of breath, and cough. And for months afterwards, they get these lingering symptoms, and it's just miserable. You know, they're not infectious. They can go back to work, but it's sure hard to work when you're feeling that, you know, that tired, and it's hard to walk down the hall without getting short of breath. And so there's nothing to do for it. It's just pacing and gradually getting over it. But the flu doesn't cause these kinds of things like this, and so it's so much worse.
So the two of you are two of the smartest people I know, and I've encouraged people to get vaccine, but they say, what does Bob know? Now, talking with two of the smartest people I know, what do you think? So Dr. Stanackzai, what would you recommend, or what would you tell people about the vaccine?
First, I just want to tell everyone that it's not a political thing. It's just a public health policy. We've had vaccines before for almost 100 years now that we've been using, and whenever there was, whether it was polio, whether it's mumps, measles, all of these required a new vaccine that we introduced, and we've nearly eradicated all of that. And I just want to let people know that there's no conspiracy. This is just a public health problem, and the same doctors you trust your child with, your parents with, are telling you that this is safe. There's no order from up to down. We kind of look at each resident, even though we're in training, we have seen the data, we've seen the side effects, we've seen how much it helps patients or people from going to the hospital and getting intubated. I would say 99% to 99% of the patients that I worked with were unvaccinated, that were intubated, that were really sick. So even if you do get sick with having the vaccine, your symptoms will be much milder, and you're likely to not end up in the ICU. It's such an obvious thing, and I wish I could just, I've been taking a half hour of my time during office visits just to try to tell people. So if there's any questions, I'm personally can leave my information, and I want people to reach out to us, not just me, but if they have any doubts about the vaccine, we can clarify them. We just want to fight all the misinformation that's out there.
Well, thank you. And Dr. Beery, I'll give you the last word.
So I believe in it so much. I immediately got vaccinated as soon as I could, and all of my family members, including my children. And that, to me, that's the best statement I can say, is that it is by far the safest thing that you can do for yourself. If you know, what I struggle with is when people get sick, then they want medicine to get them better, and there is no better medicine. You know, the other medicines that we have to give you are less tested. We now have so many hundreds of millions of doses given. We have so much testing done of this. We have the data to know that this is safe. The other medicines that we give, other than like the dexamethasone, they have been tested in fewer people, and so we have the data to show that this is safe. There are such rare risks of side effects. The vaccine is the way to go to keep yourself safe.
I don't think I can improve on that. Thank you, both of you, for joining us today. And again, thank you for all you've done for the patients in the hospital. I know the hospital is so struggling with this huge influx of patients, and you guys are part of the solution. So thank you again. Thank you so much.